Hi, Dr. Arya. Thank you so much for joining us today.
Hey, thanks for having me.
We've had some questions from family members and staff here at Kensington about booster shots, and we were hoping we could talk to you a little bit about it, and maybe you can help clear up some confusion around booster shots.
I'd be glad to. I'll try my best.
Awesome. Thank you so much. So here's our first question. The World Health Organization has asked for a moratorium on all booster shots. What is the research to prove that the booster shot is safe?
The research is still emerging around the safety of booster shots, but we do not expect any additional safety concerns other than what has already been studied with the vaccine, which is extremely safe. As we know, well over 1 billion people worldwide have already received the vaccine, and this is an extremely ineffective proven treatment to prevent serious illness and death from COVID-19. The reason that the World Health Organization called for a moratorium on booster shots is completely different, but very important. The reason for that is because we actually have a huge gap in the rollout of the vaccine when we look at high-income countries such as Canada and low-income countries. So for example, high-income countries, about 65% of people have received 1 dose of the vaccine around the world, whereas low-income countries, it's just 1.9%. And that is a very dangerous gap because of course it will lead to unnecessary suffering and death for people living in low-income countries. And that shouldn't be happening when we have this life-saving vaccine. For us, where it endangers, perhaps our residents in long-term care that we really care for and love and do not want to see getting sick again, is that this is going to lead to perhaps more variants that will circulate around the world and endanger all of us. So it's really important that we address this global gap in vaccines, and that's why the World Health Organization has called for a moratorium in these booster shots and wants to prioritize vaccinating people living in low-income countries. I do feel, and the research is starting to suggest this more and more, that the vaccine and especially the booster doses are very safe for people living in long-term care, and in some circumstances we can really argue that are very necessary as we're in the middle of a 4th wave driven by Delta and could be even a matter of life and death.
What is the data supporting the decline of antibodies after a certain amount of months or time?
So we do have emerging data from Canada as well that does support that antibody responses to the initial vaccinations does decline over time, specifically in older adults, specifically in people who live in long-term care. And that's also supported from earlier evidence from other countries like Israel and the UK. I will add that more than looking at the antibody response, what worries me is that we're seeing a series of rolling outbreaks in multiple long-term care facilities in Ontario where COVID-19 and specifically the Delta variant is spreading and even resulting in people who are fully vaccinated living in long-term care who are dying unnecessarily. So at this point in time, when we're well into the midst of a 4th wave driven by the Delta variant, it's important that we provide long-term care residents with the maximum protection that we can. And absolutely, that involves as many people as possible getting these booster doses, which are very, very important. I can explain a little bit as to why we're having to give booster doses because some people might be asking that question. It's likely because of multiple factors. So firstly, we know that older adults don't generate the same immune response that perhaps a younger person would. And along with being older, many people in long-term care have multiple comorbidities, which leaves them immunocompromised to start off with. Some of those comorbidities commonly could include dementia, heart disease, and kidney disease. Another issue is that we know that people live in long-term care are especially at risk because they live in a congregate setting. So what that means is that the virus could spread amongst multiple residents and staff very quickly, which is different than if someone lives at home. The third issue is simply that of time, where what we're seeing is that after perhaps about 6 to 8 months, that the effect of the initial vaccinations, which absolutely had a fantastic level of protection that they provided, starts to wane. So we know that we have to prioritize booster doses for the most vulnerable populations in our society. And of course, long-term care residents deserve to get boosters, and we need to get started on that immediately.
This question comes from somebody who has a loved one in long-term care, living in long-term care. They want to know, will their loved one receive the exact same vaccine?
So that's an easy one to answer, Jessica. Yeah, absolutely. That's my understanding that here at Kensington Gardens, there won't be mixing and matching when it comes to the booster dose, and everybody will receive the same vaccine. Whether it was Moderna the first time, then it'll be Moderna for the booster dose, and if it was Pfizer the first time, it'll be Pfizer for the booster dose.
If a resident is at the end of life, should they take a booster shot or can they decline?
So I think it would be important to have a conversation with your physician or nurse practitioner here at Kensington Gardens about the benefits versus the risks of developing a booster shot. We know for many people at the end of life, the priority would be on relief of suffering, on quality of life, on having good pain control. And we also know that the side effects of the vaccine could potentially interfere with that when life expectancy is limited. So as we expect, the side effects of the vaccine could include a sore arm, headache, or fatigue. And if someone is in the last days to short weeks of life, it may not be something of benefit. But once again, something to discuss with your physician or nurse practitioner. A reminder to everyone that vaccinations are very important, and these booster doses are very important to protecting people living in long-term care, but they're not enough. We have to still follow, proper public health guidelines. We have to make sure that, our family members and loved ones still get vaccinated, and there's many people out there still that we can speak to, whether it's a neighbor, family members, or friends. And when we come into long-term care, we still have to be careful where we wear a mask, we wash our hands, and wherever possible, at least, maintain distancing.
Well, thank you so much, Dr. Arya. We really appreciate you taking the time to answer our questions.
Yeah, thank you so much. It was a pleasure.